The final hepatitis virus we'll talk about is hepatitis C. So hepatitis C belongs to the flavivirus group, which is the same as some of those arboviruses we talked about before. Flaviviruses are enveloped positive sense strand RNA viruses, and hepatitis C is the major cause of what is sometimes called non-A, non-B hepatitis. It's estimated that there are 170 million chronic cases worldwide and about 3 million cases in the US. And it is responsible for about 17,000 deaths per year. The transmission is similar to that of hepatitis B, where we're talking about sexually transmitted, bloodborne pathogen. It is more likely to cause chronic infection. And as far as we know, this virus only infects humans and chimpanzees. So what we look at with an acute hepatitis infection is that the reason it's more dangerous is that actually the majority of patients will develop a persistent infection. So here, something like 70% of patients will develop a persistent infection. Only 15% will clear that acute infection right away. Another 15% will have rapid onset of cirrhosis. Within that persistent infection, 40% will remain asymptomatic for some period of time. And eventually, though, chronic hepatitis is the predominant manifestation of this disease. So it's going to cause cirrhosis, in some patients, liver failure, and in some patients, cancer. The diagnosis is based on ELISA or reverse transcription PCR. It's confirmed by Western blot. There are some therapies that are available for patients who have hepatitis C. Hepatitis G is not one that I'm really going to talk about. I already told you that. It resembles hepatitis C in terms of like viral structure, etc. But it's really not known what role the virus has in causing disease. In fact, it's really not seen in patients who are, otherwise healthy, I guess. It's just really unknown what it does. And in fact, in some of the studies I've read, HIV patients who are co-infected with this hepatitis G actually can live longer. But it's really unknown. How does co-infection of HIV and hepatitis G actually help somebody? But it is a flavivirus, and it's not real common. And the majority of patients are gonna clear the infection. So, hepatitis G is one of those that maybe in 10 or 15 years when you're teaching this class, you'll be able to talk more about it because maybe we'll know more about it then.